Good morning, everybody. Thank you very much for joining us here today, and also a sincere thank you to Dr. Brent Roussin for joining us today, and thank you, Brent, again for all your efforts. Since we began our cautious and gradual approach to reopening our economy nearly 2 months ago now, I have said, and I'll continue to say, that the future is in all of our hands. If we continue to follow the advice of Dr. Roussin and our public health leaders to mitigate our risks and follow the fundamentals, we're going to have more good days ahead. Si nous continuons de suivre le conseil de Dr. Roussin et de nos officiels de la santé publique pour atténuer nos risques et suivre les principes fondamentaux, nous aurons d'autres bons jours à venir. The best thing we can do for our health care system, for our seniors, for our vulnerable communities, for our schools, for our local businesses, for one another, for all of us, is to keep our COVID curve bending down. And we must learn to live with this virus, and that includes avoiding the activities that are known to cause the greatest risks, especially as we get back to doing some of the activities that we missed over the last few months. It seems like years ago in a way, but it was November the 10th of 2020 that all of Manitoba was moved into level red or critical on the pandemic response system, and as such, we implemented some of the tightest restrictions in our country in order to halt the spread of COVID-19 and to protect our most vulnerable and to ensure that our healthcare system had the ability, had the capacity to deal with the challenges that were real and growing. Since that critical time in our fight against COVID-19, we have learned our lesson. We must follow these health orders to protect one another because some forgot. We lost family. We lost friends that we will never get back. But when we listened and we worked together to bend that curve, we saved thousands and thousands of lives, as Dr. Roussin has shared with us. And we will treasure those lives and treasure each other perhaps even more than ever before as a result of these last few months and this last year. These measures, as tough as they've been, have worked, and these measures have saved lives too. And we need to remember that and remind ourselves, because we're not out of the bush yet. We're different people now than we were at Thanksgiving. And we know the risks better now than we did before. We know what it takes to protect one another now too, and we know that we can do that. And we have, and we must continue to. So thank you to the efforts of Manitobans. We're now in a position to consider, and I emphasize the word consider, moving the province to level orange or restricted on the pandemic response system. And this will allow us to continue to safely, and I emphasize the word safely, restore our services and activities. Grâce aux efforts des Manitobains, nous sommes maintenant en mesure d'envisager de faire passer la province au niveau orange ou restaurant dans le système de riposte à la pandémie et de continuer à rétablir en toute sécurité nos services et activités. For more on that now, I will pass it over to Dr. Roussin. Brent's going to run down some of the potential ideas we're bringing forward, and thank you, Brent.
Okay, thanks, Premier. Good morning. So we're 1 year into this pandemic, and so it's become clear that COVID-19 is going to be here to stay, potentially for many years to come. So it definitely means we need to continue to learn to live with this virus, find ways to assess and limit our risk without the use of long-term lockdowns. We do expect to see increasing case numbers as we continue to open things. This is how this virus is spread, is with interactions. The more we interact, the more cases we're going to find. But we have seen our hospitalization numbers and intensive care unit admission numbers moving in that right direction. In addition to that, spring and summer are approaching, and we continue to ramp up our vaccine efforts. We're continuing to vaccinate more and more of our most vulnerable Manitobans as vaccines become available. So that's why we're in a position again to seek feedback from Manitobans on the next steps to safely restore our services and activities, again, while balancing the need to protect those most vulnerable, balancing the need to protect our healthcare system to ensure it's there for all Manitobans. Today we've launched a survey on engagemb.ca, and we invite Manitobans to share their feedback on the priorities for potential easing of the current level red or critical on the COVID-19 restrictions to restricted or the orange level. Possible changes include increasing outdoor gathering limits, expanding capacity at retail stores, expanding capacity for religious services, expanding indoor restaurant dining to include a household and their designated visitors, allowing organized team games at indoor sporting facilities, allowing youth to not wear a mask while taking part in indoor sporting activities such as hockey, soccer, enabling indoor theaters, indoor concert halls, casinos, gaming centers to open at limited capacity levels, and removing the requirement to self-isolate for 14 days for interprovincial domestic travelers who travel for business reasons and of course do not have any symptoms. In addition to this, people are going to be asked for their thoughts on the timing, such as if these changes should happen sooner or wait until after the Easter and Passover holiday. Right now, I'm not going to put any timelines on the possible introduction of these changes pending this public feedback. As we make decisions about what changes will be made and when, we'll provide further updates. For more details on each option and to provide feedback, please visit engagemb.ca/restartmb, Pandemic Response System. Many people have asked and are interested in what's going to happen with indoor and outdoor gathering sizes at personal residences. We know that during our second wave, this was a large driver of transmission at that point. So right now, we're not considering increasing those sizes. We increased the indoor gathering size of private residences at the last set to have that as the 2 designated people or a household bubble. The outdoor limits are already at 10 plus the household, so we didn't see a reason to increase that at this point, just because of the risk involved with those gatherings that we saw in our second wave. We know Easter and Passover are coming up soon, and that people want to get together with their loved ones. We have to remember what happened at Thanksgiving last fall. We saw a dramatic shift of the cases soon after what appeared to be a lot of gathering taking place, and so we certainly don't want that to repeat. We have lots of reasons to be optimistic at this point, but we can't set ourselves back just as we're starting to roll out more and more vaccines. I want everyone to continue to follow the fundamentals. It's crucial that we take these precautions and avoid the activities that we know cause that greatest risk, crowded places, closed spaces, close contact settings. While the number of people in hospital and ICU are down, we still have to make sure the healthcare system doesn't get overwhelmed and Manitobans can access the care that they need. So again, we are looking forward to seeing your feedback on this. And we'll provide further updates over time. So thanks again to all Manitobans for your work during this quite challenging year. I'm going to pass it back to the Premier.
Thanks very much, Dr. Roussin. Our number one priority in the face of this pandemic is going to continue to be to protect vulnerable Manitobans, ensure our healthcare system's there for those who need it. That's why we're continuing to lead the fight with Ottawa in respect of restoring healthcare transfers to a sustainable level in the provinces. All premiers are united on this, regardless of political stripe. We want to see a restoration of a reasonable level of support from Ottawa, as has always been the case up till recent years. We're also focused on creating an environment for economic growth and for sustained reopening and a recovery of our economy so our businesses can safely reopen and stay open. And that's why we are leading the country in terms of our business support programs for small businesses, charities, nonprofits, and why we've focused additional programming support on some of our most vulnerable, most affected areas of our economy, the hospitality industry being one, for example. Restaurants, hotels have been profoundly impacted negatively by this pandemic. And so I would say again, as I like to do, that I would encourage Manitobans to consider supporting their local small businesses at every opportunity they feel they can. And I know our small business community will appreciate your support. I want to add to Brent's earlier comments and say that we're here to ask for Manitobans' input today and to help inform our next steps as we continue moving the province forward, and we consider moving from red to orange and loosening potentially more restrictions, even when safe to do so. We want to know what you think. We're a government that has listened, and we've listened throughout this process, and I believe that's helped us because it's helped all of us better understand what the reasons are behind the restrictions and what thought has gone into considering what we should do when we make changes to them. And your input is vital. So I encourage all Manitobans to go to engagemb.ca, fill out the survey, give us your feedback. We're asking for Manitobans' thoughts and perspectives on this virus, how they feel about it, their comfort levels with respect to different activities, different changes. Additionally, we want also to get your input on the timing issues around these changes. Should they happen sooner? Should they happen later? We want your input on these things because, of course, at the end of the day, we're all in this together, and we all need to follow these health restrictions. And a lot of people may not like doing that, but if you understand the need for it is to save lives and protect one another, I know that you'll do it. We'll all continue to protect each other this way. I just want to remind Manitobans, we just don't need a repeat of what happened at Thanksgiving. We know what happened. It's not a Thanksgiving that I'll ever give thanks for. And the fact of the matter is we don't need that to happen again at Easter Passover. COVID doesn't take a holiday, and we have to be diligent and we have to follow the fundamentals and play defense. Je tiens à rappeler aux Manitobans que ne voulons pas une répétition ce qui s'est passé lors de l'Action de grâce à la Pâques, pas de vacances COVID. Remember, when you get together, inside especially, you give COVID an opportunity to make a comeback. So the level of caution needs to remain high. Hopefully we continue to be blessed with the incredible weather we've been having and people can get outside and enjoy beautiful Manitoba. At every step of the way throughout this pandemic, we've endeavored to reach out directly to Manitobans. We're going to continue to do that. Getting your input and your feedback, hearing what your priorities are and a variety of measures has helped Dr. Roussin and I to make sure that we're making the right decisions at the right time to protect Manitobans the way we all want to do. So again, I would encourage all Manitobans to go to engagemb.ca and fill out that survey. Thank you. I'd be happy to take your questions.
Thank you, Mr. Premier. A reminder to our reporters on the line, you will have one preliminary and one follow-up question. Up first this morning from City News, Jonas.
Good morning, folks. Just want to discuss the timing of these potential changes and Easter on the way. Would it be safe to assume that there will be a little bit of a grace period post-Easter to assess numbers before these changes do come in?
So we haven't decided on the exact timing. That's what we are looking for Manitobans' feedback on this. You know, I don't think the intent of these orders would be to wait long past the Eastover, Passover to assess the effects of that. These are intended to go out now for public consultation, and then we'll look for that feedback on the exact time. We'll have more to update soon on that.
And as a follow-up on that, sir, when it comes to concerns, you know, looking back to Thanksgiving versus, you know, Easter in the spring, I guess, other than Manitobans doing the right thing in greater numbers, I mean, how are we going to judge that we're not going to see potentially a third wave, I guess?
Well, that's a challenge, right? So we have a number of risk factors right now where we're loosening restrictions. We always want to be taking that least restrictive approach that we can do to try to keep our numbers down. We know that the restrictions themselves have significant impacts. That's why we always have to be reconsidering these restrictions. We have the variants of concern here now. And then working in our favor, we have spring and summer coming, as well as the vaccine rollout. So it's all a balance, but there is no doubt that we're going to continue to need to rely on Manitobans' efforts to keep our numbers down moving forward.
From CHVN, Taylor.
Hi, good morning. Can you explain a little bit more about why it's a question to have these changes start before or after Easter, after two very important major holidays?
Yeah, and so it's just the nature of the timing of when our current orders expire. Our current orders expire sort of in the midst of spring break and just on the cusp of a gathering holiday. So that's where the options lie. Is do we allow some or all of these to proceed as the orders expire, or should we be cautious and sure we make it through a lot of this gathering time before we loosen them or some of them. So we do want to hear back from Manitobans on this.
And will there be any changes to non-regular worship activities, so things like prayer meetings or youth groups?
At this point, we focused a lot on the regular gatherings because we expect there to be a lot more protocols and a lot more enforcement ability during those sessions. So things like indoor group sizes, which apply to a lot of the other things you mentioned right now, that's still in those 3C categories. So we're going to be very cautious moving forward with those.
From the Winnipeg Free Press, Danielle.
Hi, good morning. A story published by the Free Press today details how public health didn't request or use contact tracing logs from 3 Winnipeg businesses that had variant exposures. Why should people be confident that the province can effectively contact trace and prevent the spread of these variants when the tools for those purposes aren't used?
Yeah, so we put those requirements in the orders for a reason. We want our the regions and contact tracers to utilize all tools, and so this is just one tool. The contact tracing process is quite in depth, quite complex, and so there's a lot of steps in it. But the direction from my office is let's utilize all tools that we have available. So that's been communicated.
Okay, thank you. And this question would be for both of you. How can the public be assured that the province isn't repeating the same mistakes made last fall and laying the groundwork for third wave with these additional reopenings now that significantly more infectious variants are in the community and in vulnerable settings?
I would answer that, Danielle, you can never be sure in this circumstance. We're in an unprecedented pandemic. But one thing is certain in my mind, Manitobans are much more aware now than they were last fall. When you look at the comparative charts of each jurisdiction in our country on COVID frequency, number of cases, you see that Manitoba didn't really get a first wave of any significant size compared to most jurisdictions. And so Manitobans didn't get the same degree of wake-up call, if I can put it that way, bluntly, as other jurisdictions did. And so as we went through the summer, we had weeks where we had virtually no cases at all. And I think there was a tendency, probably among some in our province, to relax and assume this wasn't a real thing for us. But it was. It was laying in wait. And when Thanksgiving came, too many people obviously didn't abide by the public health orders. And we saw the consequences of that, sadly, through the following few weeks in November and into December. I don't think we're the same people now. I think we're a lot smarter now, and sadly that took tragedy for that lesson to be learned. But again, the future, that's what I say, the future is in Manitoba's hands. I mean that we have to continue to demonstrate we've learned how to bend that curve. We've learned how to do the right things, and there's no 100% in this, Danielle. I think everyone knows that. But I have a lot of confidence in Manitobans being able to keep doing the right things Brent, over to you on that.
Yeah, I don't have a lot to add to that. I think we've all learned a lot from the beginnings of our second wave, and we know that this virus is still here. We're still seeing numbers, and even as we open things up, we're seeing some of that test positivity even gradually increase now, as we expect. So we have to be very cognizant that if we, again, lose track of those fundamentals, we could look at a third wave and have to move backwards. And I don't think there's anyone who really wants that to occur.
From Global News, Marnie.
Good morning to you both. Is these changes being considered province-wide, and or would the Northern Health Region also be considered to move into level orange?
Yeah, at this point, these are being considered province-wide. And certainly interested in Manitobans' feedback. But I think we, as we loosen restrictions moving forward, as we get more into the out of the critical red for all the province, then we could look more at those regional approaches. And so for right now, this is province-wide that we're planning.
Thank you for that. And my other question is related to vaccines. With more people over the age of 65 now getting vaccinated, there could be kind of a sense of relief, or people might be letting their guard down with seniors, or seniors themselves letting their guards down. What message would you want to say to those people that have the vaccine and maybe feeling a bit more relaxed?
So right now it's too early to be thinking about that. We're just begun rolling this out to the general population. I think it's a very optimistic time as we see more and more of our most vulnerable Manitobans getting vaccinated. But it's too early to let our guards down. Again, moving forward, as we get more and more people vaccinated, especially the vulnerable Manitobans, we're going to see this shift away from the importance of daily case counts to more on that the strain on the acute care system. Because the goal, the evidence shows that these vaccines are quite good at reducing the severe outcomes, hospitalizations, ICU admissions, and deaths. So we are really looking to benefit from that. We should be optimistic about that, but it's too soon to change our behaviors based on that.
Here too that it's true in sport that most games are won or lost in the last 5 minutes, and it's important for us to remember we're not there yet. We're not at the end of this challenge, and we are in the midst of it. And so for folks to be relieved when they get their vaccination, I think is a wonderful thing, and I know that people will be excited to do that. But I know also they're not just thinking of themselves. Here in Manitoba, we also know that there are other people out there that have not yet got their vaccines. They are at risk, and we need to do our best to protect every one of us as we go through this together. And hopefully over the next few weeks and months, we can look at even further dropping of restrictions and so on. But in the meantime, we have to make sure that we're all in this together.
From the Brandon Sun, Colin.
Good morning. So far in the province's approach, there hasn't been much of a regional approach to levels of restriction except for the northern region. If we end up going down to orange and then cases start to increase, do you foresee the whole province being raised back up to red, or would you only elevate the warning level of the region in question?
Yeah, it's of course going to depend on the situation that we see, but I do think as we come out of the critical red on the pandemic response system and into orange province-wide, that is going to set us up into a better position to do a more regional approach. But again, it's going to depend on the specifics of what we see.
I also just wanted to clarify, if we do go down to code orange, is it correct that I'm reading in the release here that the household rule would still be in place for dine-in restaurants, but they could also have their designated household visitors. Is that correct?
The proposal, so as it stands right now, is if you're going to dine indoor, you can only dine with members of your household. This would allow you to dine with members of your household plus the designated visitors to that household.
From CJOB, Malika.
Good morning to you both. Dr. Roussin, this question is for you. We're talking about hospitalization numbers and ICU numbers coming down. I'm wanting to know if we can get some more clarity as to when non-emergent surgeries in all hospitals can start up again with those numbers coming down. So I know we're looking at reopening, but patients are still being told that they don't have a surgery date at this point because ICUs are still full in certain hospitals, i.e. St. Boniface. So is that going to be going into looking at the survey to reopen for Manitobans?
So we definitely have seen the trend in the right direction for hospitalizations and ICU, but as we said, there's longer, certain proportion of clients that are staying longer in the ICU, and so we still do see some strains in ICU. We're not back to normal for sure. And so I'll let others speak to the specifics of, timing of the surgeries and things of that nature. But yeah, I mean, all of these loosening, all of these proposals are really at that, trying to find that balance. We know the restrictions have significant impacts, but we know we're not done with this virus. We know we can't overwhelm our healthcare system because that also has impacts on non-COVID care as well. So we're looking to find that balance of where we can ease these restrictions to, but at the same time get back to have our healthcare system function to pre-COVID levels.
Malika, this highlights, I appreciate your question because it highlights one of the consequences that this pandemic has had, not just in Manitoba, but right around the world. This pandemic pileup of surgeries being delayed impacts on, we've got preliminary numbers, more than 1.5 million Canadians right now that are delayed in their ability to get cared for. So it's a monumental issue, and we've been raising this, premiers have been raising this with the federal government repeatedly. It's an issue that needs to be addressed, and it won't go away. It's going to worsen. We already had wait time difficulties throughout the country. Manitoba had been holding its own on not seeing wait times grow among the provinces. It was the only province, according to the Canadian Institute of Health Information, that didn't see increases in the last test period. But you can't you can't ignore the effects of COVID, and the reality of it is that it's created even longer backlogs, and wait times are going to be pushed up as a result. So again, a motivation, I hope, for all Manitobans to do the right things, follow the health orders. Let's get back to where we can give people that are waiting for cancer treatment or various other ailments, cataracts, knee surgery, you name it. Let's give them the relief and the help that they need too, and get our system back as soon as possible.
Thank you. And just for Dr. Roussin, I remember asking this question about 2 weeks ago, and you had said that potentially you'd get someone get back to me. So this is Malika from Global News. If someone could get me some stats or anything like that, that would be greatly appreciated if there are some stats. And then my follow-up question is, how's the province looking to verify that people will be traveling for business purposes if we do open up, removing the requirement to self-isolate for that 14-day interprovincial domestic traveler requirement who don't have symptoms?
Right. Yeah. And so, I mean, this goes into the proposal, again, and I think it's not necessarily unique to any aspect of our orders. Enforcement is challenging. So right now it's difficult to enforce the 14-day isolation requirements as they are. As you add in more exemptions, then it becomes more and more challenging. It's similar to the proposed restaurant rules. Enforcement again will be quite challenging on that. So we have to take that in consideration as a proposal. And we know that our success on these have always relied on Manitobans cooperating with us and doing their part. Enforcement is quite a challenging aspect of this.
Thank you.
From the Winnipeg Sun, Scott.
Hi, good morning to both of you. We have spread and exposures of various concerns now, yet we're banking on Manitobans to heed a wake-up call from the fall. I guess what would give either of you confidence that we're 2 months out from potentially having 70% of the population vaccinated? I'm trying to understand why rush this at the moment when we potentially are pretty close to having a reasonable amount of the population vaccinated.
Yeah, well, I think it's back at the balance. It's so people who are dramatically affected by these restrictions probably don't feel it's a rush to loosen things, so we're trying to find that balance with this. So we know there's risk involved with everything. We know there's risk involved with some of these restrictions. They have significant impacts. So we're constantly trying to find that right balance, with knowing that we just can't live in a lockdown forever. And this virus isn't going to be going away in 2 months either. Definitely optimistic. We want to see good uptake by Manitobans. It's definitely going to put us in a lot better position. But we're not done with this virus in 2 months, so we have to find ways to have the least restrictive means possible for these restrictions.
All right, thanks for that. Restaurants are now going to, I don't know if they even have to kind of police this, but designated contacts of homes, it almost seems like that makes it more complicated for restaurants to figure that out than it is to just allow people from, other households to go out for dinner. Why micromanage it like that? Why not just either allow it or not allow it?
Well, the issue is if we have 6 different people sitting at the same table from 6 different households, that dramatically increases our risk. We know that having the household limit that we have in now is quite limiting to both patrons and to operators, but it was the best way to ensure we could open things up with keeping the risk down. We've now got to a point where further loosening increases risk and decreases the ability to really enforce it. And so we're going to have to rely on Manitobans, if that proposal goes through, to follow this. Because if you're going out, sitting at a table, prolonged periods of time with people who already are your designated visitor at home, that doesn't substantially increase risk. But we know that that's going to be very tough to in any way police. And so that's the risk we all have to consider with this proposal. And it has to ensure that Manitobans are on board with us. Because, if we have multiple households sitting at a table, prolonged period, indoor, prolonged contact, we're going to see a lot of transmission.
Too many rules doesn't work. Reasonable rules will work. And Manitobans have proven that over the last number of months, and that's the direction we're going to continue to take, Scott.
From CBC Radio Canada, Alexia.
Hi, good morning to you both. My question is for Dr. Roussin. I heard about some French people in Manitoba not being able to renew their passport because there's currently no option to do it here. So they have to go to Toronto, which is expensive, and they have to self-isolate when they return. So are you maybe thinking about removing the requirement to self-isolate for diplomatic staff so they can come to Manitoba?
Yes, we are considering that, and also, the proposal in front of us is to remove the requirement to self-isolate for anyone traveling for, work or business purposes. So that proposal's in front of us now.
Okay, thank you. I don't have any follow-up questions. Thanks.
From CBC Manitoba, Jill.
Good morning. Dr. Roussin, if we're seeing obviously a rise in variants of concern, I'm wondering if variants of concern become the dominant strain here, how will public health react? What changes would you make to protocols or restrictions?
Yeah, and so we've already made some changes when dealing with variants of concern, being a bit more aggressive with case and contact identification and follow-up. Once we hit a certain threshold, and it'll depend on a number of things what that threshold is, then we just start treating every case as a variant of concern. Rather than trying to wait for the screening. So right now it's too early to do that, although the proportion is increasing, it's still relatively small. But at some point, if we find that that's the predominant strain, we'll just be treating all case and contact management as if they were variants of concern.
And my follow-up is the other day you mentioned that contact tracing has become more aggressive. What does that involve? What did you mean by that? Can you give some specifics?
Yeah, and so the big thing is that we're going to be looking to to ensure we're casting our net wider to find contacts. And so we've had a sort of a 15-minute definition in the past. We've dropped that down certainly to 10 minutes. But our contact tracers, our public health nurses who have been working quite hard since the beginning of this pandemic at contact tracing, we've advised them to look for higher risk settings. We don't have to be firm on a 10-minute setting, especially for a variant of concern. Because we've seen transmission occur with less than that. So we are casting that wider to name more contacts. We're going to have entire households self-isolating if somebody is isolating at home. Because we've seen transmission in those events as well. So we really need to, as we loosen some of our public health measures, such as the restrictions, we need to tighten up on other ones, such as case and contact management.
From the Canadian Press, Steve.
Oh, hi there. The Winnipeg Jets have sent out a reminder about season ticket purchases to season ticket holders, and they've expressed some optimism that they will have some limited capacity fans in the stands. Has a decision been made on allowing fans in the stands at sports events?
No, a decision has not been made on that. I think there's good reason to be optimistic for some increasing in the ability for us to do this. It's going to be largely dependent on the vaccine rollout and vaccine uptake from Manitobans, but certainly no decision has been made at this point.
The way they're playing, we want to get in and watch them as
Okay,
soon as possible, Steve.
Sorry, go ahead.
I was just going to say, the way that the Jets are playing, we all want to get in there and watch them as soon as possible, but we have to remember that public health issues have to take precedence right now.
Okay, and some of the indoor areas being considered, theaters, concert halls, casinos, I realize the proposal here is limited capacity at 25%, but these are areas where people sit in an indoor area for a prolonged period of time. Is it realistic to open these large venues at this time?
So it's definitely it carries risk with it. And so we all need to be aware of that. And so we do want to set out these proposals. Again, the timing is up, and even the proposal themselves are up for consultation with Manitobans. But as far as public health is looking at this, this is a dramatically reduced capacity with a cap, and so and be a lot of guidelines and protocols in place. So absolutely, there isn't anything really in these restrictions that don't come without risk, but it's again trying to find that balance.
I'd add to that, Steve, by saying that this is perhaps the most profoundly damaged part of the Canadian economy. Manitoba is no exception. The arts and culture community has suffered significantly as a consequence of the necessity for the lockdowns that we've undertaken here, and other provinces have as well. And we've been able to address through programming supports some of the damages done More, I think, will probably need to be done. The other industries affected have had special programming supports offered. Hotels, for example, recent announcement on that. Outfitters, the hunting lodges, restaurant supports. But, you know, to make cautious openings possible in these venues, it's something we want Manitobans' input on, and we want to hear your voice on engagemb.ca on what you think about these things, because it is, you know, a lot of your fellow Manitobans that are engaged in these industries. They work really hard. They haven't had the opportunity to perform, the opportunity to even, in the early days of this thing, even practice and prepare the way they're used to being able to. So it's I feel for this group of people, as we all do, I think, profoundly affected by these things. So we're going to move cautiously, but moving in the direction of restoring some ability to resume some activities is something that the public health progress we've made so far, thanks to Manitobans, may make possible. And that's exciting, I know, not just for those folks, but for all of us.
Our final reporter this morning from CTV Winnipeg, Michelle.
Hello, I'm just looking at the difference between critical red and orange restricted on the website. And one of the main differences is in orange, we have more control over testing and contact tracing. So are you using that testing and contact tracing ability to make this decision, or how does that factor in?
Well, it's certainly relevant to that. We feel we have significant testing capacity to match demand, if that should that demand increase over time. And same thing with contact tracing capacity. We've increased our capacity in both of those areas to meet increasing demand. So we feel that we're certainly in a much better position than we were with the very high numbers we were seeing in the early first wave.
I'm also wondering about the mask mandate. Is this something that's going to persist farther into the future? You did say, you know, the virus isn't going anywhere in a couple of months. We will likely be dealing with it for several years. What's the outlook on mask wearing?
You know, for the foreseeable future, we're looking at masks in indoor public places. But it's really difficult to predict what that looks like going forward, right? We have to see, vaccine uptake, how long immunity from the vaccine lasts, the effects of variants of concern, what we see in fall. And so it's too early to predict where we're at. I would say that we're at an optimistic point right now. But we're not at a point where we can be seeing a time when we're done with this virus. We're going to have precautions in our lives for the foreseeable future.
I'll just wind it up and say again, thanks to Dr. Brent Roussin for joining us today, and just to throw in that the more people that take the vaccine, the more people that get that vaccine, and the sooner that they get it, the better chance that we can shift away from some of the restrictive measures that we've had to take, including things like masks. But again, it depends on the uptake. We need to get to that herd immunity level. Level of caution needs to remain high in the interim because the cavalry isn't here yet. And remember that when you get together inside, you give COVID an opportunity to make a comeback, and we don't need a COVID comeback. So stick to the fundamentals, limit your risks, avoid the 3 C's. Close contact settings, crowded places, closed spaces. Remember to wash your hands. Stay home when you or any member of your family is ill. Wear a mask. Limit your close contacts. Stay positive. Be smart. Have a heart. Stay apart. Thank you.